Let's talk about the medical benefits of living with a service dog. What does the research show for specific conditions that service dogs are commonly trained to help with? I'm Dr. Raj. I'm a medical doctor and co-owner of Summerfield Service Dogs. The first condition we're going to talk about is a little bit more general, and it's psychiatric conditions. And specifically, we're talking about the use of psychiatric service dogs. This was a survey study done online of 199 adult patients, and they reported a number of different psychiatric conditions. Most of them, at 84%, had depression, 61% had social anxiety, 60% had generalized anxiety, 62% had PTSD or post-traumatic stress disorder, and 57% had panic attacks. There were some other categories where the numbers were in the 10 to 15% range, including borderline personality disorder and bipolar disorder. And there was also another category that was just labeled. The owners reported what kind of tasks their psychiatric dogs did to help them. And they reported that 94% of them reported that the dogs reduced their anxiety through tactile stimulation. 71% reported that there was nudging or that the dog would do to bring the patient back into the present. 51% said that the dog would interrupt undesirable behavior. 50% said that the dog maintained constant body contact. 45% reported that deep pressure stimulation was given by the dog. And 42% said that the dog would block contact from other people, which obviously can be helpful. If you think about it, that dog is essentially creating space for the patient. And if you have generalized anxiety or just any kind of anxiety, panic attacks, social anxiety, or PTSD, which is commonly associated with anxiety, those can all be challenging to be out in public among other people. So I can see how that would be really beneficial for people. Now, the outcomes here, the patients reported that the psychiatric service dog usage did a number of things. 46% actually said that the dog decreased their utilization of psychiatric or other healthcare services. 30% said the dog increased their use of the services, and 24% said there was no change. So this is interesting. When you delve into it further, I think that data becomes more clear. So patients who reported that there was a decrease in service use actually reported that they were having fewer suicide attempts and had fewer or less requirements for hospitalization or medications. And the patients who reported that they had increased utilization, they actually were reporting that they had enhanced ability to attend the appointments they needed. For example, an outpatient clinic, perhaps to visit with their psychologist or psychiatrist for further management of their psychiatric disease. So the service dog enabled them to be able to participate in less emergency care and more of the care that helps them manage their condition outside of the emergency care system, which would be a big benefit for a patient. The next condition we're going to talk about is PTSD, or post-traumatic stress disorder. This is a common disorder veterans end up suffering from, and this study included 156 adult patients, and 81 of the patients had a psychiatric service dog for PTSD, and 75 patients were in what's called a waitlist control arm. They were just on a waitlist, and they were surveyed, and the authors looked at specific outcomes for PTSD, which is a PTSD symptom severity, and they also looked at the severity of depression and anxiety. And this was done after 3 months of either patients having a service dog or 3 months of them just being on a waitlist. They also looked at quality of life and social health. They found that patients who had a service dog, when compared to the waitlist, had improved symptom severity for the PTSD. They had less depression and anxiety, and their quality of life and what they called social health was improved. This is an interesting study because PTSD not only leads to a lot of anxiety for patients, but that can result in them withdrawing from social life, being bound to their home and not being able to go out and about and do what they need to do. And it can also be accompanied by depression, and we already talked about anxiety. And the study showed that the involvement of the service dog improved a lot of these problems for these patients. The next study looked at cortisol and dopamine changes in humans and dogs. And they compared 18 adult humans with 18 dogs with what they called placid temperaments. The humans also had to have positive views of dogs, not necessarily fearful of dogs or anything like that. And they looked at more outcomes than just what I mentioned, actually. They looked at their mean arterial blood pressure, which is just one way of measuring someone's blood pressure. Most people are familiar with their systolic or diastolic blood pressure, which is the top and bottom numbers. The mean arterial pressure is sort of like a mathematical equation that incorporates those two numbers. And they also looked at beta endorphin levels, oxytocin levels, prolactin levels, phenylacetic acid, dopamine, and cortisol levels. So all of those except for cortisol sort of tend to increase, and that's a positive thing, or basically they reflect relaxation or feelings of happiness. And the cortisol is considered the stress hormone and can be elevated in people who are feeling a lot of stress, or at least that's what it's thought to be the relationship. And what they found was that when the humans and dogs had a positive interaction, in both humans and dogs, their mean arterial blood pressure actually came down, which can be suggestive of a feeling of relaxation. And at the same time, their beta endorphin, oxytocin, prolactin, phenylacetic acid, and dopamine levels came up, which, again, many of those can reflect feelings of relaxation or happiness. Humans also showed another interesting change. Only in humans, their cortisol levels actually decreased, and that can reflect a decrease in stress. Now, there's another study that I'm going to talk about, and this is looking at cortisol levels, again, in a similar population earlier, and patients with PTSD, post-traumatic stress disorder. And this looked at 73 adult patients who were post-9/11 vets. 45 had a service dog and 28 were on a wait list. And they looked at the service dog participants and made comparisons to the wait list participants. They found, actually interestingly, that the service dog participants had a higher cortisol awakening response, which was a cortisol level taken when they wakened from sleep in the morning, and a higher what's called area under the curve, which is sort of like mapping that change and looking at a specific number when it's graphed out. Those with a service dog actually showed, similar to before, significantly lower anxiety, anger, and sleep disturbance, as well as less alcohol abuse. And if you're not aware, people who have trouble with PTSD and other psychiatric conditions can often end up in the position of abusing alcohol and drugs. And that was all compared to those on the waitlist control. So it was interesting that the cortisol awakening response was actually elevated in the service dog group here. The authors reflected that so far the literature on this has been really mixed, and they said it might be due to how it's being measured, as the way they measured it was different than some of the other studies, and it's really unclear how to use this metric at this time. They also pointed out that the cortisol awakening response, which they called CAR, did not associate with the improvement in symptoms that patients reported. So they weren't sure how to use that information in this specific study, and just said further studies need to be done on this. The last specific condition we're going to talk about is another psychiatric condition called autism spectrum disorder. And this was a specific study for kids with autism spectrum disorder. However, not only pediatric patients are affected by this, but adults are too. And one thing that was interesting about this study is there are already a number of studies that look at autism spectrum disorder and have shown that there's a strong association between a psychiatric service dog and improvement in symptoms with ASD. But this study actually looked at changes to not only the child, but also to their family members. And what they found when they looked at 20 children matched with their parents, and they followed them from baseline before a service dog, and then they tested them at 3 and 6 months with a number of different surveys, they found a lot of positive changes. The surveys looked at things like autism behavior, anxiety, parenting stress, something called the Monash Dog Owner Relationship Scale, and then parenting styles and dimensions. And what they found was that the child with autism spectrum disorder had a lot of improvement in their symptoms and ASD severity, and at the same time, the parents' stress improved. They were actually able to correlate or associate the improvement or degree of improvement of the autism spectrum disorder symptoms to the improvement in the parents' anxiety and feelings of stress. Another interesting finding was that they found that the quality of the relationship between the child and the service dog, when that was a higher quality, they found that the benefits that both the children and the parents received were higher. So in other words, when the bond was stronger between the dog and child and also the whole family benefited more from that service dog intervention. So that concludes our discussion of some specific conditions and the data that shows really some impressive improvements for patients with autism spectrum disorder, post-traumatic stress disorder, a variety of psychiatric conditions like depression, anxiety, panic attacks. And also we talked generally about stress responses and relaxation-related hormones and how those change when a human has good interactions with a dog. So again, my name's Dr. Raj. I'm a medical doctor and co-owner of Summerfield Service Dogs. If you're interested in a service dog, give me a call or shoot me an email and I'd be happy to help you. This isn't medical advice, but I do like to share some of the literature out there that supports the use of service dogs for patients who need them.